there, and welcome to Muscles of the Appendages, your upper and lower limbs. We're going to be looking at the upper limb with the arm and the forearm on it. And on the forearm, actually on the arm, we have two main muscles we care about, the triceps and biceps brachii. Those two words are important there. You need to tell me that we're talking about the arm. There's actually a biceps femoris that we'll see elsewhere in this video. Triceps brachii is on the back side. It is right back here. It does have 1, 2, 3 heads on it, and that's why it's called triceps. We're going to turn this back around like we're shaking this guy's hand, and I can see the biceps brachii right here. Don't just call it biceps. Don't call it bicep. That'll make me crazy. You know that. And we're going to move on down to muscles in the forearm. We have flexor carpi radialis, flexor carpi ulnaris, and there's one more in a little group that I want to talk about called palmaris longus. Yes, I know I skipped some. We'll come back there. What I want you thinking is about what happens when you close your hand into a fist. The bottom part down here is tightening up when you flex, and the upper part down here, when you stretch your fingers out and extend them, those are extensors. So flexors are down here, extensors are over here. So we need to go on this side for some flexors. And there are 1, 2, 3 flexors that I want to point out, and they are out of order in our list, and that's fine. What I want you remembering is where two bones are on the forearm of the skeleton. The ulna is on the little finger side, and the radialis is on the thumb side. So as we look at this, little finger side, right there is flexor carpi ulnaris. Happens to be number 25 on this model. Then jumping over 1, 2, 3, we have this one right here, happens to be number 23 on this model, and that is flexor carpi ulnaris. The carpi part on that means that it's attaching here at the wrist. In the middle there, we actually have one called palmaris longus. Yes, I know we skipped a bunch of extensors. That's cool. We'll come back and get that. So we have flexor carpi ulnaris, flexor carpi radialis, and palmaris longus right there. We're going to next take a look at extensor carpi radialis longus and extensor carpi radialis brevis. That's these two muscles right here. On this model, they're number 20 and 21, and they kind of point ultimately at the thumb side, which is where you would expect the radius to be. Back over on this side, on the little finger side, looks like it's number 32 on this model. That's going to be extensor carpi ulnaris. Sort of in the middle, and you can follow this muscle and notice it's got tendons coming down to all the fingers, not the thumb. That is actually the extensor digitorum. You don't have to worry about saying communis on there, but that is extensor digitorum. Happens to be number 30 on this model. And that should take care of all of the muscles of the upper limb that you need to look at. Let's move on to the lower limb. Muscles moving the knee joint. And we're going to begin with the area where I'm going to say, don't call these hamstrings. There are 3 muscles that you casually might call hamstrings. We're going to call them by their proper names. There's biceps femoris, semitendinosus, and semimembranosus. So as we look at the leg model, the first thing you want to do is find which is the big toe side and which is the little toe side. We're going to come up on the little toe side to this muscle right here. This muscle on the little toe side is the biceps femoris, or biceps femoris, whichever way you would like to say that. Coming on the big toe side, we have this one here, which is actually a pair of muscles. The first one we're going to see there is the semitendinosus, which is this muscle right here, very large tendon on that. And underneath that, we have the semimembranosus. So semitendinosus, semimembranosus, and biceps femoris are the muscles that you might call the hamstrings. Moving on, we need to find some other muscles moving the knee joint, and that would be the gracilis sartorius, and then a group that you might collectively call the quads or quadriceps. We're going to begin with the gracilis and sartorius. Here we need to go on the big toe side. We are on the inner part of the thigh, and this muscle right here, a big long strap, is the gracilis. So sartorius has got the distinction of being the longest muscle in the body, and it is 62 in your list. Now we're going to take a look at these 4. You might call these 4 the quadriceps. They actually have individual names for all 4 muscles. rectus femoris, vastus lateralis, and vastus medialis. For the vastus lateralis and medialis, you need to keep in mind what is medial and what is lateral. And what we're going to do with that is realize that the big toe is on the medial side and the little toe is on the lateral side. So we're, again, kind of going for the big toe side. We're coming up here. These are the muscles we care about right now. This one in the middle is rectus femoris. This one on the big toe side is the vastus medialis. And this one on the little toe side, there's the little toe, is going to be the vastus lateralis. That leaves us with a burning question. If this is medialis, this is lateralis, and this is rectus femoris, then where in the world is vastus intermedius? Well, intermedius kind of means between. So I have to actually take the rectus femoris off. And underneath there, we see the vastus intermedius. The beginning of it is up here. Nice big long tendon right there. We could peel that tendon away and see more of it. We can't do that on the plastic. So that takes care of the muscles of the thigh that we care about. We're now looking at muscles moving the foot. And I'm going to take us to the area that you would refer to as the calf of the leg. That's going to be two muscles we're going to care about, the gastrocnemius. Note the odd spelling there, gastrocnemius. And then underneath that, we'll find the soleus. So back at our leg friend, if you want to orient yourself to big toe, little toe, I'm turning this around. And we can see what you might call the calf down here. My thumb is over the Achilles tendon. And this big muscle right here, which has two heads, one of which will come off on this model, that is the gastrocnemius. Sorry for the wobble, mildly heavy muddle. And what I need to do is actually remove this as a group. We'll lay that down for just a moment. I will show you that right here along the side, we see another muscle. That is this one right here. That is the soleus, which lives directly underneath the gastrocnemius. So gastrocnemius, which I just took off there, that's that big calf muscle. And underneath there, we have the soleus. So that will take care of those. We now need to move on to the anterior part of the leg. Tibialis anterior is going to be our first stop. And that is this muscle right here. The big clue for that is it's right adjacent to the tibia. So this is tibialis anterior. The next muscle we want to find is extensor digitorum longus. And that is just toward the little toe side on the front part of the leg. And if you notice, the extensor digitorum longus on this model actually comes free. But the bigger deal is that it actually has tendons extending down to all of the toes except for the big toe. Big toe is handled by something else. Moving on up, we have a couple of muscles more we care about. The number 76 here is flexor digitorum brevis. Flexor is a curling motion. This is the one that flexes the toes. I often casually call this the bear paw. You won't be calling it bear paw in the test, but we look at the bottom of the foot to find this. And this is that flexor digitorum brevis right there. And you can see it sort of looking like a bear paw. Do not write bear paw on the test, but that is flexor digitorum brevis. Now we have three more muscles to look at in the lower limb. One is flexor hallucis longus. That one, you have to actually take the gastroc away. We've already done that, but I'll just sort of put it back in position to show you. We'll move that. And this right here, number 43 on this model, is flexor hallucis longus. You want to keep in mind that the word hallucis actually means big toe. As long as we're on the big toe, we have this muscle right here. It's number 52 on this model, and that is the abductor hallucis. It's going to take that big toe and pull it laterally like this, sort of widening it toward the other big toe on the other foot. We also have an abductor digiti minimi. Digiti minimi, little toe. So let's turn this guy over on the little toe side, and we see a very clear muscle right here. That is the abductor digiti minimi. That takes care of the foot, and that takes care of all of the muscles of the upper and lower limb.